Welcome back to the Morning Scramble. As I mentioned, it is National Women's Health Week, and it is an important week for us to stop necessarily worrying about everybody else and not ourselves. Dr. Angela DeRosa is here to talk about that with us. It's a day, it's a week when we need to just refocus on ourselves and what's important for us and our health, right?
Absolutely. Women are notorious for putting everybody else first, as you said, and we often get to the point where we have to almost schedule our own nervous breakdowns. So before we get to that point, we should be looking at preventative health so that we don't get to that point.
One of the ways we can do that, obviously, is knowing what important tests we need to be having at what point in our life to save lives.
Absolutely. And although it's just a week, we really should be doing it all year round, thinking about preventative health. So even as young as in our 20s, we need to be thinking long range. How do we prevent bone loss? So looking at how our dietary intake, family history. We want to also look for melanomas. The young population today, they're going in these tanning beds and they're also exposing themselves traumatically, and unfortunately it's leading to a lot of skin cancers. So having a doctor actually disrobe you when you're getting your pap smears and STD screening, all those typical things we do in our well woman exam and our breast exams, have them look at your skin too, because that can be a very, very interesting thing that you can find a lot of good information by just looking at our skin.
So you don't necessarily have to book an appointment with a dermatologist?
Not necessarily. Certainly our primary care physician, your gynecologist, internal medicine, primary care at family practice, they can do a first over screen, but then if they see something unusual, then we should head off to the dermatologist.
So let's talk about our 30s, because obviously our bodies are starting to change, and that's when we start getting to know cholesterol levels and knowing when we should have a baseline mammogram, because there's a lot of controversy as to when we should have that, right?
Well, typically in my office, we like to get a baseline in the 30s to kind of know what normal looks like for most women, because a lot of dense breasts can hide things as age goes on. But definitely we want to be looking at those pap smears again, breast exams, looking at your cholesterol, doing diabetic screens, talking about dietary prevention, because once that midsection weight gain comes on, which we just so love.
That's your lovely 40s.
Exactly. Welcome 40s. So certainly kind of starting to talk about preventative health, but then when the 40s hit, Mother Nature just wreaks havoc on our bodies. Not only do we start having those hormonal symptoms, but then our risks start to go up for things like breast cancer and ovarian cancer and various other things, and then the dreaded 50s.
Well, so going back to our 30s and 40s for just a moment, with the cholesterol screening, the diabetes screening, and even the thyroid, is that something that you can get from your general practitioner?
Typically, most primary care physicians are going to think the basic things, cholesterol, sugars. You might want to look for more specialty areas when you're starting to think about hormonal screening. Not all doctors are created equal here, in particular when you're looking at thyroid disease, because they may just look at a standard TSH, which is the screen that most doctors will test, but there's bigger tests and much more detailed tests, including T3, reverse T3, and free T4. So those are tests that you can ask for, but not all primary cares are going to know about those. And also they may have a different skew on hormonal health, and those are really the root causes of often cholesterol issues. Testosterone deficiency can lead to glucose problems and can lead to prediabetes and diabetes and weight gain. Thyroid can lead to cholesterol abnormalities. So you really need someone who's going to be looking at those things, because they can be the root of all evil.
Well, so it's all connected, and then you get to your 50s and you have to start worrying about your bone density as well.
Oh yeah. So we want to rock those shoes and those fancy dresses. If our bones aren't holding us upright, we can't do that. So the bone health is really important, because not only vertebral fractures, hip fractures, can they cause a lot of pain, they can cause disabling disfiguration, but also death, which we never like to hear in medicine. So it's really important that we look at dietary options. We look at vitamin D, because it not only prevents falls, but it also helps keep our bones healthy and strong, and making sure that we're not going down that path where we're starting to slump over and have those hip fractures like our little grandmas.
So I know a lot of doctors, yourself included, you recommend getting those annual well checks every year. It's not just for the kids. Should we also be getting our blood checked every year too, just to decipher what's happening with all these different things?
It depends on who you ask. There are certain medical societies that suggest that we should be waiting until 25, 30, and even later for certain blood tests, depending on the family history and risk. But I tend to take a little different approach. We want to treat to prevention and wellness, not treat to illness. So I'm not going to typically wait till I'm starting to see signs of illness before I start to intervene. So getting a good baseline early in our life is a good opportunity, not only to understand what's normal for you, but also it gives me an opportunity yearly to discuss things with you. So in particular in the young population, STD screens and your risk for getting those infections. Making sure that you're taking good dietary health changes in your life and exercising. So those are opportunities just say, yeah, you're on track, or no, you're not.
Yeah, very important. And I love on your website too that you have a breakdown of all of these very life-saving tests that we should be getting at the various stages of our health.
And women, we're always thinking about everybody else. Take
Right.
the time. Let's think about ourselves. Don't schedule that nervous breakdown.
Yeah, it's so important, especially this time of year. We want to
Exactly.
remind folks where they can find you on the
We're
web.
all over the valley, but we certainly can look at DeRosaMedical.com. We have locations in Gilbert, Chandler, Glendale, and certainly in our main hub in Scottsdale.
And Dr. DeRosa is also on Twitter, and I love her Twitter handle, Dr. Hot Flash. Yes, you'll never
Been there,
forget that,
done
right? Follow her. She's a wealth of information. Stay with us. More Morning Scramble when we come back.